Hey folks, good afternoon. Thanks for joining us. I'm joined today by my colleague Uzoma Asagwara, who is the MLA for Union Station and our health critic as well. Today, we are calling on the government to increase the amount of information that they are sharing with Manitobans. We've seen time and time again that one of the ways the coronavirus can spread is in a vacuum of information. When Manitobans don't have the facts, that seems to be one of the opportunities that the pandemic has to make inroads against what we all want, which is to turn the tide against COVID-19. In particular, we would like to see more information released, information that I would add the government has already promised to release to the people of Manitoba months ago at this point. So again, this is your information. You've paid for this data to be collected. Your tax dollars are going to fund the collection of this information, and yet the Pallister government is concealing it from you. It's information about workplaces, about which communities are being affected, about the other interventions that we could make to help fight the pandemic. This is information that you could use this week as you begin to evaluate the government's plans around reopening. So I'm going to introduce my colleague now to, I think, spell this out in a bit more detail. But again, our call is for Manitobans to have access to more information because we trust you to be able to make the best decisions about your health and our public health here in Manitoba.
So we, over the past many months, have been calling on this PC government to be transparent when it comes to the public health data that we know is being collected specific to COVID-19. So, over the last couple of months, we now know that workplace transmission accounted for about 25% of the rates of COVID transmission in community. That's a really good example of concrete data which, had it been public, could inform the way in which employers and workplaces, employees and citizens keep themselves safe and navigate our communities during this pandemic. And so what we're calling for, and what we've been calling for many months, is for the government to be transparent with the data we know they've been collecting. The experts have explained very, very clearly that publishing this data, making the public aware of the information, allows for folks to be able to make informed decisions about how they keep themselves and their families and communities safe. And we know that data, good data, is what informs good public health strategies. And so it's with that information in mind that folks can have a better understanding and appreciation for the public health decision-making and strategies that this government is taking, and you're going to have increased buy-in. When folks have the information, when they understand the data, they're going to be more inclined to buy into the plans and do their part from an informed perspective to bring the rates of community transmission right down. So, what we're saying is that we know COVID-19 disproportionately affects some communities. When we look at racialized communities, senior communities, for example, we know that the rates are higher in those communities. We've certainly seen it in data that's been presented by other jurisdictions. And so it's important for us here in Manitoba to have a good sense of what's going on with COVID-19 transmission. It's important for citizens to have a good understanding of which communities are affected and why, so that we can figure out collectively how to bring those rates down, how people can protect themselves, how we can move forward in this pandemic in a way that is equitable and that sees folks be able to, on a more balanced, a more balanced level, more balanced way, more meaningful way, be able to keep themselves safe. So, these are points that we've made several times before. We've made these points in the House when we were in session. We've made these calls on social media. Like everyone else in Manitoba, we expected this information months ago at this point. It's long overdue that the government provide this information. So I think now we can open up for questions if you folks have any questions.
Are there other examples apart from the workplace numbers that you would like to see?
Yeah, absolutely. We've called on information regarding workplace transmission. We've called for data around race-based data. We know that's been collected now for many, many months. Manitoba was one of the first jurisdictions to commit to collecting that data. We are one of the first jurisdictions to commit to collecting data that we knew was necessary to inform good public health strategy and policy. And yet we're lagging, we're falling behind other jurisdictions in actually being public and transparent about that data, about coming up with plans based on that data. And I think, quite frankly, we're seeing the impacts of this government not being transparent about that data. We're seeing the impacts of the government not consulting with the communities who are affected by this data. And we're seeing that over the last several months with the explosion in COVID transmission we saw in the community. We're seeing that with folks struggling to, totally buy into what this government is saying, because the government is not matching the commitment of the citizens of Manitoba and being transparent about the decisions that they're making and how they're being made.
Can you comment on that with respect to vaccine prioritization today? Dr. Reimer said, when she was asked about the priority list, said that, that's on hold for now because the vaccines are on hold. So can you talk a little bit about that?
I think that statement is interesting and kind of concerning, to be honest with you. We know that part of the issue here in Manitoba with navigating different stages of this pandemic has been a failure to plan on the part of this government. And so what I'm hearing in that statement is where we know that priority groups can and should be identified well in advance of even receiving doses of the vaccination. We know the importance of planning well in advance to make sure you know who is going to be prioritized in getting this vaccine. And so if now what we're hearing is, well, we're going to wait and see, how we're going to plan, that's reactive. And we know that being reactive hasn't served Manitobans well. In fact, it's been a disadvantage here in Manitoba that has cost lives. And so we need to know that this government is being proactive, planning well in advance, establishing those priority groups and being transparent about how those decisions are being made and who is being prioritized and why. Do you want to add to that one?
Sure. I can add. Yeah. I think what we've seen in the vaccine rollout so far is that you shouldn't be waiting to hear the sound of the vaccine dose truck backing up before you start making the plan of who's going to get it. I mean, we all know that they could be identifying the priority groups and in which sequence and at what time along the timeline that Manitobans could expect to get a vaccination in a doctor's office, in a pharmacy. So again, this is something that we're pushing for. We think it's important for Manitobans to have that transparency. We think it's important for you to have a clear expectation of when you should be able to get vaccinated, because we all want to do our part and help end the pandemic.
Do you expect this data to maybe reinforce the need for regionalization in terms of whatever restrictions we see come Friday?
I think that, so the geographic data will be released, I'm assuming, on an ongoing basis as it currently is. So I'm sure that will inform the announcement that we see later on this week. But what I would say is this. The number one thing that I think the data would show is where Manitobans should hold this government accountable. And I think that the reason that they don't release this information, even though they promised to do so within a week several months ago, is because they don't want to be held accountable. And if you were to release information on workplaces on an ongoing basis, well, then the government would have a responsibility to protect workers. And if you were to release information on different cultural communities on an ongoing basis, then the government would be responsible for having to invest in working with those communities to keep Manitobans safe. And so I think the failure to release this information is a reflection not only of a public health failure, but of a failure of accountability for this government.
The NDP exposed an issue this weekend with a wrong address being given for the Keystone Center to I guess, a group of healthcare workers who are about to get the vaccine. The contract to the company that the government said made the error, it was described as in the disclosure of contracts, Petal MD got a $436,000 contract and it was categorized as an emergency contract. Should there be an emergency contract awarded? It seems to suggest that all of a sudden the government realized that, oh, we need help in getting alerts out to people about where to go for a COVID vaccine. And I'm just wondering what you think about this contract as an emergency contract.
I think the nature of the contract being an emergency contract, most likely untendered, the tone of the emails, all of it, and the mistake itself, all of it serves to show that the government is not prepared for the vaccination plan yet again. I think Manitobans are rightly asking themselves, how is it that the government keeps dropping the ball time and time again with what we know is probably the most important public health intervention in our lifetimes? And you saw in the emails themselves, the government knows that they've messed up. They know that it's not the first time that they've messed up. They've done it again. They've done it again and again. And so, just speaking from the perspective of the average person out there, they really need to step up. They really need to improve their performance, because right now the PCs seem to just be getting it wrong time and time again. The average person out there, I'm sure the average person understands that everyone makes mistakes from time to time. But how is it that this government seems to be making mistakes every single time, at every stage of the second wave response and at every stage of the vaccine rollout? So I think there's, on the face of this issue, you have a lot of healthcare workers who got caused unnecessary stress and confusion. But there's a lot of other questions that the nature of the contract and how it was awarded are also triggered here. And, again, if you're going to rush into an untendered contract and you're going to get such poor results, it probably tells you that maybe there could have been a better process in terms of figuring this whole thing out. We would always say that, you should look within the public space. We got public health nurses who could have been helping with this. We could have been managing this internally. Instead, you got a government that's always rushing to privatize. And in this case, we see that happened at the expense of quality, and it's healthcare workers left holding the bag.
According to the emails, it was only after the second mistake that they said, well, maybe we should vet these messages, or we should, before they go out.
Yeah, checking the work, I think, was the language that was used. So you have a government that awards a $500,000 contract and they don't even check the work of this person. That tells you that the government is not doing their job. And what's the impact? Stress and confusion for healthcare workers. A mix-up on the opening day of the Brandon vaccine site. These are all preventable errors. These are unforced errors, and they really just point at how the government continues to mismanage what we all want to see go right, which is the vaccine rollout.
Just further to Larry's question about, and you were mentioning privatization, the initial email alerting the province to the problem was somebody who's on the Priorities and Planning and Priorities Secretariat and is the CEO of a private research firm or consulting firm. Is that an issue? Like, is it very common to see somebody who's in that role also involved in high-level management of a private consulting firm?
I think that this is one of the areas that we want to look at very closely. What is the nature of the relationship between the different folks around the table? Are there other interests at play? I don't have a clear picture of why that email address was used in this chain, but I can tell you that that's something that we definitely want to look into and research more, because I'll tell you what, if anyone involved in the vaccine rollout has an email address that says big healthcare in it, I'm sure that raises the eyebrows of most Manitobans.
Maybe just in français?
Oui, en français.
What the purpose of sending out this data information then?
OK. Alors, pour nous, c'est très important d'avoir l'information présentée aux Manitobains au sujet de quelles communautés sont impactées par le virus, dans quel secteur de l'économie est-ce qu'on voit les pandémies qui s'avancent, parce que ça va nous aider, comme Manitobains et Manitobains, de prendre une décision nous-mêmes de quelles mesures seront les plus effectueuses pour arrêter l'augmentation des cas ici à Manitoba. Alors, c'est un enjeu que nous avons agi pour pendant plusieurs mois. ça fait quelques mois déjà où le gouvernement a promis que dans une semaine, ils vont publier l'information. Mais ici, 2021, nouvelle année, nous attendons encore cette information. Et c'est de l'information qui appartient à vous. Vous avez payé pour cette information. Et c'est d'informations qui pourraient vous aider de faire votre part pour annuler la pandémie. Et puis sur l'autre enjeu, nous avons déjà vu plusieurs fois dans la pandémie et puis dans le programme d'immunisation où le gouvernement a fait faute. Et c'est leur faute. C'est eux qui ont pris les décisions d'embaucher cette compagnie. C'est eux qui ont pris les décisions de ne pas regarder à leur travail. Et finalement, c'est leur faute qu'il y avait plusieurs personnes qui travaillent dans le système de santé à Brandon qui étaient données de mauvaises informations. Alors pour nous, c'est une situation où le gouvernement doit améliorer leur performance.
Merci.
Merci à toi. All right, thanks, folks.